Hello, everyone. Good afternoon on this Friday, Phase 3 day. Let's go over some of the information, touch on some points, and then take some questions. We had no one pass in the hospital over the last 24 hours, but according to the New York State website, it looks like we lost 2 individuals in nursing homes over the last 24 hours. So certainly, let's think about them and their families, and keep them in our thoughts and prayers. Certainly it's a reminder that we're making progress with the virus, but it's still deadly, and we need to remember that as we move into each phase, that it's still a serious threat to all of us. So let's please keep these families in our thoughts and prayers, as well as the other 164 individuals and their families we've lost to this pandemic. When we look at testing, now 48,767 tests, 48,101 tests have been returned, 940 returned since yesterday. There are 2,389 positive results since March 16th. That's 23 new cases. And 45,712 negative results over the period of time. We have sent 881 tests since yesterday. We have 666 pending tests. Our infection rate is down to 5%. When we look at this, remember when we were doing symptomatic testing with targeted proactive testing, that rate was 8 to 8.4%. Now we're doing universal testing. That rate is dropping and will continue to drop. Over the last 3 days on our New York State Department of Health eClair system, our 3-day average 0.9. So very strong data, certainly very good. We're doing robust testing. We're picking up a lot of asymptomatic tests, folks that are just curious. Again, in nursing homes now, the employees are being tested once a week. A lot of our positive results related to facilities have been employees who are asymptomatic. So the good news is that we're doing so much testing that we're able to quickly trace and track and quarantine and isolate. And that's why we're seeing the progress we're making as we move into phases and more people are together. Looking at our testing schedule for next week, Monday, we will be at the Brighton Towers. That will be for residents and staff only. There's a lot of residents and staff there, but we will be there. So if you live at the Brighton Towers, chance to get a COVID-19 test on Monday. Tuesday, Baldwinsville Central School District. We will be there, 29 East Oneida Street, out in the town of Lysander. Certainly, please take advantage of it for our residents in Lysander. Wednesday, we will be working with the Syracuse Housing Authority at various sites, so we will not have testing for the public at large on Wednesday, but we'll be testing various sites at the Syracuse Housing Authority. Thursday, at the request of legislator Tim Burtis, Cicero North Syracuse High School, we will be there on Thursday in Cicero. So again, that will be open to the public. If you live in Cicero or a neighboring town, or you're in that side of town and you want to get a test, please come by our mobile testing site. We will continue to go into every part of the county and every neighborhood, and if we see a trend in any part of the county related to new cases, we will do robust testing within that community to try to track and trace the virus. Looking at our testing goals, again, this is infrastructure we've built up so that we can continue to go into different phases of restart and to prepare us for whatever variable this virus has for us. 775 a day is our goal for Central New York region. Yesterday, 1,702 tests, good number. When we look at our hospitalization numbers, down 2 from yesterday, we're at 55. and we have 15 individuals awaiting a negative COVID-19 test so they can return to their homes and nursing homes. So our real hospital number is 40. Just tremendous progress we've made. COVID-19 is not threatening our medical infrastructure whatsoever, but certainly let's keep everybody in the hospital in our thoughts. You know, this is obviously not where we need our neighbors to be, but from the standpoint of our medical infrastructure, we are in very good shape in Central New York and Onondaga County. 14 individuals are in critical condition. That's the same as yesterday. To give you an idea of the percentage compared to our active cases, that's 1.6%. But please keep these folks in mind over the weekend as we're enjoying our liberties. These folks are in a fight, so please keep them in mind. Looking at who is in the hospital, 34 Caucasian, 15 African American, 2 Asian, 4 have declined to share demographic information. When we look at the number of recoveries from hospitals, 314 people have gone to the hospital sick, gotten better, and been released. And then when we look and dive into our positive cases, again, 2,389 cases, a little over 0.5% of our population at this point since March 16th, up 23 on the day. 8 of these folks are household contacts of previously confirmed cases. So these folks were already in a quarantine. They eventually become sick with COVID because someone else had it within their household. For us, this is kind of baked into the process. We know that this can happen and likely will happen. They're in a quarantine, so the risk to the community at large is contained. When we look at senior facilities, 5 new cases from senior facilities. That's a good number. We've had higher numbers. Very happy with that number, going in the right direction. These folks are highly likely to represent that transition to hospitalizations. So we're happy when that number gets very low. And that leaves 10 cases community spread. Again, a good number. We've been a little bit lower, but still very happy with the number 10 for community spread as we're finishing up phase 2, going into phase 3. We would have taken that every day and twice on Sunday in the beginning part of this process. So happy with that. We still need to be diligent and vigilant now as we go into phase 3. Please, please, please wear masks. There's more and more information showing how this is very helpful in preventing the spread of COVID. Just because we can now be together more, be outdoors more. When you're in our parks, if you're within 6 feet of each other, you need to be wearing a mask. It's worked. So please continue to do that so we can continue to see really, really significant progress with the fight with this virus. So now, phase 3, it's more important than ever that we continue to do what works. 6 feet, physically distancing. When we're not within 6 feet, when we're within 6 feet of each other, we have to wear a mask. So please continue to do that so that we can quickly move on to phase 4 and get more and more liberties back and get more and more businesses back opening at full strength. When we look at active cases, down again. I think this is our 4th day in a row. Active cases are down 10 since yesterday at 855. Recoveries up 31. 1,373 individuals have now recovered. When we look at a little bit more of who our cases are and from a demographic standpoint, 1,433 have been female, 956 male, 122 under 19, 394 in their 20s, 317 in their 30s, 287 in their 40s, 366 in their 50s, 298 in their 60s, 243 in their 70s, 222 in their 80s, and 140 in their 90s. Where does everybody live? The first number is total cases. The second number is recoveries. City of Syracuse, 1,363 with 727 recoveries. Town of Clay, 182 with 137 recoveries. Town of Geddes, 140 with 37 recoveries. Town of Onondaga, 138 with 52 recoveries. Town of Salina, 104 with 73 recoveries. Town of DeWitt, 85 with 62 recoveries. Town of Manlius, 82 with 64 recoveries. Town of Cicero, 72 with 50 recoveries. Town of Camillus, 71 with 49 recoveries. Town of Lysander, 42 with 38 recoveries. Town of Van Buren, 30 with 18 recoveries. Town of Pompey, 27 with 24 recoveries. Skaneateles, 15 with 15 recoveries. Town of Lafayette, 9 with 4 recoveries. Town of Marcellus, 9 with 7 recoveries. Town of Elbridge, 5 with 4 recoveries. Town of Atisco, 5 with 5 recoveries. Town of Tully, 4 with 2 recoveries. Town of Fabius, 3 with 2 recoveries. And Town of Spafford, 3 and 3 recoveries. Today's a good day going into restart. Phase 3, appreciate the early communication on this so that businesses can take advantage of a Friday night, restaurants specifically. This helps our economy. This helps get people back to work. This helps with mental health. We just need to be smart. And for us to get into Phase 4, we need to continue to see the data stabilize the way it has, hopefully see some progress as well. But we need the public to do this. You have got us to this point, not me or not anyone else. It helps having Dr. Gupta and the health department and the hospitals leading the fight, but the public at large has responded so well, and that's why our data has moved where it is. To continue to do this and to continue to get the state to work with us on opening up things that we need opened up for our economy, we need to continue to be smart. So please keep that in mind. And again, Child Care Solutions, 315-446-1220. Daycare for those who are now going back to work through June. We still have 2 weeks here. We'll look at that program for July and see where we are fiscally, see if we can still support it. We want to. We'll have an update on that soon. At this point, I can take questions. I'll save some restart and economic questions for you if you have them. Questions?
So we're doing really well as far as cases being down. As far as, other states opening up nationwide, there's been trends where cases have gone up. How are we going to be different? What can we do? Are you guys nervous at all, especially heading into Phase 3?
So I know that there are other states that are seeing different spikes. They did things a little differently than what we have. I also think that what I learned, and again, this is a personal opinion, but I think there's something to it, is that this is a facility-driven virus. In the event, if you look at when we had our cases very high, just when you look at the season we were in, when we would interact, we were usually indoors. And now, in these other parts of the country now that are seeing larger cases, this is kind of when they go indoors. It's too hot outside. They spend a lot more time indoors. So I think that has something to do with it. I think I'm not sure where these other states are with wearing masks and enforcing these things. I'm sure there's multiple factors that go into it. And some of these states went from having no cases or very few cases. I saw Utah on a graph. Utah had, no cases, and then now they're getting some cases, right? So it's not like an outbreak situation. But certainly other communities have not fared as well as New York has in our community in Restart. We're aware of that. We're cognizant of that. We've built up the testing infrastructure and we've built up the tracing infrastructure where we're comfortable and we're micro-targeting just like we have been. We micro-target our cases. We tell you what they are and how we view them. So I think we're in a good spot, and I think we're smart. And so we just can't, some businesses have gotten, they're opening up, they're getting excited, feeling the moment a little bit, maybe aren't being as strict with some of the rules. We just can't have that because, if we're at a restaurant and all of a sudden we get 10, 15, 20, 25 cases because of people not following the rules, that sets us all back, and that sets a narrative that might hurt your business and hurt your industry too. So let's just be smart. Hey, Tom.
Hi, Ryan. Two-part question. One, there's been discussions of pay cuts. What's the latest on that? Job cuts.
Yeah, so restructuring, $100 million hole essentially is where we are. sales tax payments come in, you get a estimated sales tax payment for a period of time, then you'll get another estimated sales tax payment, and then you'll get a small payment, which is a correction from the payment two periods before. So yesterday we got a correction payment of sales tax from April, which showed that April wasn't as bad. We had a little bit of growth in that payment year over year. So April, instead of being off 35%, it might have been off 32%, right? Still off in a big way. So we still think our number is about $100 million when you look at the potential state cuts, and you look at our revenue losses, and you look at our increased expenses. So we've come up with solutions to help us get through part of that. We can't get through all of that without restructuring. So we've given the legislature options to consider. The COVID energy surcharge, which would be temporary over a period of time to get us through this COVID pandemic, is one option. If we get that passed the legislature, that gives us 30 days to wait for the federal government to see what they're going to do in early July, and we would then, after that, be able to assess if we have to have restructuring within county government. If we don't get the COVID energy surcharge, we then certainly probably have to make moves sooner than we want to related to restructuring.
At this point, you have no idea how many right now. It's kind of a waiting period for about 30 days, you said?
We know we need guaranteed revenue, because each month that goes by, we lose that opportunity on cuts. So with the surcharge, that would get implemented in September. It would get us about $3.7 million. It would get the city a little over $1 million as well to help with their crisis. So essentially, if we don't get that, we have to find $3.7 million in the next 30 days. There's very little more we can do to find that without looking at restructuring of hours.
Have you considered a pay cut for yourself at all?
Yes.
Okay.
Yes. So there will be, if anything is asked of the workforce overall, certainly we're going to take a cut as well. Yes.
Ryan, we've been talking about waiting for federal funding for more than a month now. I believe in early May we began discussing it. Is there any, do you still have hope that federal funding could come, and how devastating will it be if it continues to drag on?
I do. They have to do something. I just don't know how they don't, especially now that some of these other states that Senator McConnell, Leader McConnell's colleagues from are being impacted by the virus differently, including his own. So I think there will be something, and I've seen the bills. We helped craft some of the bills, and I know Senator Schumer and Congressman Katko have been very strong advocates of a bill that we helped with, and I know what that gets us. I think that'd get us $40 million in Onondaga County, which gives us a fighting chance. Some of these other bills, I'm not quite sure how that's going to play out, but we need something, right? And if we can get something that gives us at least options. But if this thing keeps delaying, then we don't. What would happen is we would have to restructure. Then maybe we get something later. Then maybe we can reassess and bring back some of these hours into the workforce. But we're out of time. We don't have the ability to raise more revenue, essentially, outside of the one surcharge. And we have, if you have a $40 million hole mid-year, that means I have to cut $80 million to get to the 40 with 6 months. So if I wait another 60 days and my hole is 40, that means I got to cut $110 million or $100 million to get it. So these are just horrible, horrible options. And again, we didn't create this mess. We had a balanced budget. We ended 2019 with a $7 million surplus. We would have been there again. So think of, if I got to help my friends in Washington think of this a different way, let's think of it like this. Let's think of it like a PPP loan for large employers who happen to be governments, and hold us to the same standards of keeping our workforce with that. So if that's how we have to think of it, let's think of it that way. Hi, Michelle.
Can you take us through what your expectations are for the timing of Phase 4? Will it be in 2 weeks? Again, the governor's office reviews the numbers, or do you think this one will take longer? it's big groups of people.
Yeah, I don't think so. If you, I think, especially, certainly there's mass gatherings going on every day in our community now, sanctioned or unsanctioned, and you learn a little bit from that. And we haven't seen cases yet. I have Dr. Gupta asking specifically, I want you to go back and all these community spreads that we've got in. We haven't gotten a lot of them in, but I want to know if any of them were at a protest. And so that we can then communicate where they were, when they were, just like we do if there's a gap in the investigation. And they've been doing that, and we haven't gotten anybody. So I think that you learn a little bit from that, and that's been why we've been advocating for maybe doing a little bit more, you know, and so we learn more as we go into phases. So I think if it's 14 days, and if the data has a small spike or stays flat, why don't you? We can't, the virus is going to be here until it's not, and the virus will make that decision. So you build up the infrastructure to maintain it, to maintain your hospital infrastructure, and you prepare for it the best you can. And I think New York's done that. I think we've done that. What's going to hurt us is when we don't have the infrastructure or the ability to fight it because we don't have any more money. That's what could really hurt this. And I think that's, you know, there's economic engines that I will make the argument every day that should be open right now that aren't open yet, and we can do it safely. So I think phase 4, 2 weeks, things go well, and then I think you see the governor probably doing what he did yesterday.
And so what do you tell people who, a lot of the guidance from the state is about business, obviously, but what about people who are just planning social events? What do you say to people who want to have a golf tournament this summer or a road race tomorrow?
Yeah, we've been helping people, suggesting that they push things off to July, hoping we're in phase 4 and then this takes care of itself. Certainly we're working with State Department of Health, with our health department on guidance for things like weddings and other events like that. And so, Dr. Gupta is working with her counterparts of the state and some of the other larger counties about doing this so we can put out guidance. But yeah, some of these events that if they're planned outside of phase 4 and they're gray, they risk having you know, these events be disrupted if they don't meet the guidelines. And so I know that there are some events that get planned around the community, and there's different large gatherings that get planned that aren't prohibited. You know, I think it's a matter of enforcement, that if you have the infrastructure to enforce it, you enforce it. But certainly we get people calling in with complaints all the time where we're going out investigating, enforcing when we can. And the state's getting some calls and they're doing the same thing. But that's part of our concern with those, is that we need to continue to be smart so that we keep the progress, so in 2 weeks you can have these events.
For weddings, are you suggesting that the county would have guidance rather than the state on weddings?
We're working with the state on guidance with that. These are questions, and there's certainly our health departments are working together on guidance for that, and certainly in phase 4 you can do weddings now. They're just limited numbers, right? So in phase 4 certainly those will loosen up, and we want to be able to give the guidance like that earlier if you can, so that these folks getting married can understand how that would work. You know, the receptions can understand how that can work. So it's important that we give as much information as early as we can.
There was a road race scheduled for tomorrow. Are you familiar with that?
I am familiar with it. Yeah.
Have you talked to them, or what's going to happen?
We have, yep, we got a complaint. Our investigator went out. The governor's team called us on it, told us what their concerns were, and they've been communicating back and forth. I'm not sure where it stands. I know you can't have groups of 50 going out running. I know you're a runner, and so I don't know if you're racing tomorrow, Michelle, if that's a protest or not. But I don't. This stuff becomes so complicated, because if you send out groups of 10, and then a half hour later you do it. So we're talking with the governor's office and passing along the messages from them on what they think's appropriate and not. I won't say the governor's office, the governor's representatives. And we've been communicating with the organizers of that race. Tom.
This being the last day of school, children will be out all summer. Plans on playgrounds opening?
We are looking, I know probably next week we'll open up the playground at Onondaga Lake Park, working with our Parks Department and our Health Department on how we're going to have cleaning protocols with that. Some of the other playgrounds we'll be assessing as well. Part of this, unfortunately, to Josh's questions about help in our federal or our funding situation that you were bringing up earlier, part of this is that we're going to have to start whacking things we like to do and not opening up things. Not so much playgrounds are different, but some of our parks certainly, if we don't get help or if there's certain decisions made with our local legislature that don't happen, we're going to not be able to do some of the things we normally do that cost us money. And that's the reality. And so we're assessing not just hours of people for restructuring, we're assessing shutting down services as well.
Is also there a plan for special needs summer schools?
I'm not familiar with what the plans are. I know that the one-on-ones, I believe, are being allowed now, but I don't know any specific plans yet. Hey, Josh.
Ryan, some restaurants we've talked to that even though we're going to phase 3, they still feel they're not safe enough to open. They don't have the ability to follow all the guidelines and stay open. Has your office been fielding calls like that, and what kind of guidance have you tried to give them?
Yeah, I think that if you're a business owner and you don't feel like you can do it in a safe way, you're being responsible by not doing it at all then. I have not heard specifically from a restaurant that is in that position, but I've taken advantage of the outdoor seating myself. I've been trying to, when I'm getting around the county and stopping at different spots, and certainly you can see a challenge maybe with more capacity, and especially around a bar. How do you keep people 6 feet apart? So that's going to be a challenge for these business owners, but I think most of them will be up to the task, and they'll learn from each other. And the more outdoors you can, if you're in that space, you can push people, the better. And that's why we did our executive order allowing for the seating to be expanded without all the different variances that the red tape that these businesses would otherwise have to go through.
And I'm going to get way ahead of where we're at. We now look ahead to phase 4. Is there any indication of what happens after phase 4? Is there any indication of what?
Yeah.
Is there 2 weeks and then it's back to normal life? Like, is there any indication what happens after phase 4?
I haven't heard of phase 5, so let's hope that phase 5, 6, and 7 don't happen. So my assessment would be phase 4. Hopefully, you're back. The businesses are going. Maybe there's a couple specific things that your mass gatherings that you want to see a little bit more time moving on, but I think once you're at phase 4, you've tested this virus so much at that point that you know how it's going to perform if you do things smart. And so what happens then, you become too comfortable, you loosen up too much, then you see yourself going backwards a little bit, and then you risk some of those phase 4 liberties might be in jeopardy, I think. I don't think you can ever go back to complete shutdown unless unless the virus hit us so severely that everybody was kind of in agreement, like, this is scary. So I think once you get to phase 4, I think you're there. And then that's when we just got to continue to be smart. We know enough about the virus. We're buying time for the medical community to come up with the antiviral treatment and the vaccine. And we've bought them a lot of time. And the medical infrastructure in most communities has been fine. So hopefully phase 4 is phase 4, then there's no more phases.
The governor today talking about how police agencies should formulate a plan. Have you talked to the sheriff's office at all about this? I know they spoke about it today about use of force and that sort of thing.
Yeah, so I got a heads up from the governor's team before he made the announcement. We will look at it and try to understand it. We have a role to play in this as a county executive. So we'll work with the sheriff and we'll assess the categories that the governor wants to see community engagement and dialogue and plans and relooking at policies and procedures. So beforehand, I didn't have a role to play in this. With this executive order, I do. So we'll take that role very seriously, and we'll have a community dialogue with the sheriff, and we'll have everybody at the table. We'll have all residents at the table, and certainly we'll engage directly with Black Lives Matter and other stakeholders, and we'll grow as a community from it. Tom.
This has to do with nursing homes, and I know it's nothing that's directed towards you, but in a case that I had to deal with, nursing home tested positive, their employees for COVID, and they chose the route of going to Facebook to let residents and family members know. Do you talk to them and explain to them that that might not be the brightest idea, considering we're talking about nursing homes with elderly people? Many of them might not have internet access, or their family members might not be on Facebook. I mean, I had no idea that Sunnyside had a Facebook page.
Well, that's a horrible idea, first off. So I've not talked to nursing homes about their communication with families, but to post that on social media just it isn't a good practice. And so certainly we've worked with nursing homes on building up testing infrastructure, making sure the PPE is there. At one point we had pretty much a crisis level in nursing homes with this virus. So it's gotten better, but certainly any communication related to what's going on with people's loved ones should be direct communication with those families. Josh.
We're getting another taste, or more taste, of normalcy this weekend with the seating and restaurants slowly opening up. What is your biggest concern as we head into this weekend and start phase 3?
I think I want people to enjoy themselves and enjoy what we have accomplished together. I just remember how we got here, and remember how tough it's been, and remember that there's still some people on the sidelines in our community that are desperate to get going. And so let's not give any excuses not to go to phase 4. And so that means we need to continue to wear masks and be diligent and respect one another and do what works and repeat everything we've learned so we can continue to have that success. Because there is people that are desperate who are in phase 4 now, desperate to get open. So we owe that to them so they can get the ability to make a living back. So I think that would be my message. Please enjoy yourself. We've come a long way. We didn't know how this was going to work out when this happened in March. Nobody did. Now we've just done so well, but we still got people on the sidelines. We got to get them open. So we owe it to them to do things smart. Michelle.
Back to sports. Can you say more specifically now, about kids practicing? Wednesday you said they could, up to 10 kids could practice youth sports, but I've had some questions since then about what kinds of sports, indoors or outdoors, tennis, gymnastics.
So where we get 10, Michelle, is because the governor has an executive order about gatherings of 10. So any gathering of 10, what's the difference if you have a gathering of 10, if it's 10 of us in a gathering, or 10 people passing a lacrosse ball around or a soccer ball around? There's no difference. So related to guidance on leagues, the state has told us they're going to come out with guidance on leagues for youth sports. What we've referenced is, we get the question, if we are going to have a practice and throw the ball around or kick the ball around under 10 and under, that's very consistent with the governor's executive order already. So we've been, again, when we push and push and push on issues like this, gyms, destiny, graduations, we are not, there's not a day that goes by, there's not 2 hours that go by where we're not pushing the state of New York if we think that there should be something done and we can do it safely. So this youth sports falls into that. We want to be able to give more guidance than that about how to do it. I don't want to do something that's going to trigger a reaction across New York State. Sometimes I say things that get reported and every county across the state saying McMahon just did this, why can't I do this? Sometimes you need to read the guidance and make decisions, and you don't ask for permission for everything when it's just common sense. So we've given common sense interpretation on that. Anything more than that, we think the state needs to come out with, and we think they will.
I think the question people are having is whether you mean just an informal, group or something sanctioned by a real league or team.
I don't.
Want to be insured.
Yeah, I don't think. I don't see the difference, and so I don't see the difference if you're a gathering of 10 is a gathering of 10 to me. What you're doing, if you're within 6 feet of each other, you should have a mask on. So that's. I'm very comfortable with gatherings of 10s based off the governor's executive order. Other questions? Okay. Certainly I want to congratulate everybody. This is a big day for many businesses, for all of you. Hopefully you'll go support your favorite restaurant this weekend. You can sit inside or outside. I always recommend outside if the weather permits. But we've come a long way together. We've done these briefings together. Next week I have some personal things that I've gone through over this pandemic that I have to deal with. So I will not be as available for these briefings. We'll decide what we'll do next week. Certainly, we probably won't be doing anything in the beginning part of the week. But just want to thank you all again. Please, please, please be smart and be safe. Enjoy the success we've had fighting this virus together. And if we do this well, phase 4 is right around the corner. Thank you.